In this video, I'm going to show you a very quick functional screen for the hips. The idea is that we want to get an assessment of the patient while she's standing and gravity is compacting the joint, and then that can guide our table-based examination that will come later. The first thing I want to do is assess her in the frontal plane. So what can her hips do left and right? So just move your hips literally just left and right. You can bend the knee as you're doing this. So I'm getting her to bend the opposite knee. She's coming this way, come this way. No, opposite knee. I'm getting her to bend that knee, and then she goes that way. I'm getting her to bend that knee. And I'm seeing there's a tightness, but you might be able to see this as well, tightness on the right side. She's not going as far. Good. Now we want to take the legs wider apart and do a little bit wider than that and assess the abduction or the adductor muscles. Okay, so go left and right. Good. And I'm seeing how far does she go, what happens. Now you'll notice here, as she go this way, her hips drop backwards and there's a slight rotation there as well. And so that's indicative of something on the right side again. Excellent. Come back. So that's the frontal plane assessment. Now we want to move into the transverse plane. So lift the heel of your right foot, the foot closer to me, and then just twist your hips that way. Good. I'm looking at how far can her hips go round to the right. And the way I like to measure this sometimes is take a mark on her ASIS on that side and then see how far this one can come round to it. So without hopefully not blocking you too much, if I put my hand here level with her ASIS, so you take this hand round this way, I can measure how far that comes. So it was a bit sort of 3 fingers. It's an arbitrary measurement, but it's just so you can compare sides. Good, change sides. And this one comes around as well. So if I was doing this as having her as a patient, I would obviously be making some notes on this. Now I want to look at external rotation. Stand on your left foot and just open your hips up this way. So we're looking at how far can she go, what happens to her knee, foot, and ankle as she does this, and then go the other way. And is there sort of a weight shift that shouldn't happen there? Is she uncomfortable? And there's something going on in this right hip as well. She's transferring her weight onto her left. She's not staying on that right foot. Her knee's going down and in just a little bit. So we know there's something to look for there. Right, the last plane of motion is the sagittal plane. So turn and face the windows there. First thing I want to do is see how much extension she has. So lift up the heel of your right foot. Good. And then she's going to drive her hips forward here. And I'm just going to take a measurement. Just drive your hips forward. Good. I'll just put my hand there just so we've got a marker now. I'll keep going again of where she got to when her left hip was the sort of the target hip. Change sides. So now her right hip's the target hip. And you can see that she's not quite going the same distance. There's a pull back on that right side, and there's a little bit of a rotation there. So we know that her right hip is tight in all 3 planes essentially. So the frontal, the transverse, and the sagittal plane.